Wound from shotgun. Larger the caliber, greater the distance to which the powder is discharged. Card travel for 2 meter. Ward travel for 2 to 5 millimeter. Ward produce minimum minor injury up to a distance of 3 meter. Entry wound. Entry wound from a shotgun depends upon distance from which weapon is discharged. Size of the shot, nature of the explosive, the firearm. Distance at a close range, the shotgun is the most formidable and destructive of small arm. Discharge from a shotgun produces a large, long, shallow cone of shot. Its apex is at the muzzle of the gun. Farther along the victims is larger the wound is. Hard contact. Characteristic cruciate laceration. Cruciate wound or stellate laceration. Laceration in the shape of a cross, seen especially if there is a bone immediately underneath the skull, caused by gases entering beneath the skin and coming out through the same wound. Flowback phenomenon. Sometimes there may be subsidiarily linear tearing extending from the cruciate wound. Bone underneath shows a large irregular hole with a fissured fracture running from the margin. Crazy paving pattern is sometimes seen in skull. It is a crisscross pattern resembling irregularly shaped paving stone superimposed on a background of ground glass opacity. Involves the base of the skull, roof of the orbit and middle ear, bursting fracture, burst head, burning, blackening and tattooing of bone. In skull wound, frequently soot may enter the inner surface of the skull, may blacken it from inside. Dura may also be blackened, soiling and burning of the wound. Minimal, because all material discharged from the gun is driven within the wound. Track of wound. Seared and charred by flame, blackened by powder and smoke. Blast effect. Shattering and destruction of tissues are maximal. Effect decreases, range increases. Back spatter. It is the ejection of blood, cloth fibers, hair and tissue fragments from the entry wound towards the firearm. This material is also ejected from exit wound, but that is not back spatter. Occurrence and degree depend upon anatomical location of wound, range and caliber of weapon. A contact wound of the head from a large caliber weapon is more likely to produce back spatter than a distant wound of the torso from a small caliber weapon. Etiology of back spatter relevant for a contact wound. Negative pressure in the barrel created immediately after firing. Expansion of gas trapped subcutaneously relevant for all ranges. Intracranial pressure generated by the temporal cavity. Tail splashing. Backward streaming of blood and tissue along the lateral surface of the bullet. This may represent an early stage of the temporary cavity effect. Seen in all firearm but more common with a shotgun. Seen at all range, but blood and tissues etc. are found within the muzzle of the gun only in contact with and close range. Medico-legal importance is cross scene reconstruction, crime scene reconstruction. It can be found inside the barrel, outside the weapon, on the person shooting and on one person or object nearby. Assist in differentiate between suicide and homicide. If entry is through a cloth, ammunition hole in the cloth touching the muzzle may be surrounded by a flat ring corresponding to the outline of the muzzle. Loose fibers of the cloth in the center of the hole may be turned in, stuck in the wound. Sometimes there may be turned outward due to pressure of the gas returning from the entry wound. Smoke may enter within the clothing, may blacken each layer of clothing within and even skin. If cloth is blood stained, soot may not be recognizable. Infrared and ultraviolet photography may be helpful. Also examine cloth from inside. Where a soot may be recognizable, entry hole in a cloth may show singeing. Synthetic cloth may show melting of fibers tip. A ring of burning may be seen around the wound also. Other features same as that of loose contact or near contact. Thank you.